Cecostomy. Introduction. The colon absorbs leftover and forms stools. Select true or false. Correct. Digested food that has not been absorbed in the small intestine reaches the colon or the large intestine. In the colon, the leftover nutrients get absorbed and stools are formed. Can a cecostomy be used to treat any case of bowel incontinence? Select yes or no. Correct. A cecostomy is used only for severe cases of bowel incontinence. Is a cecostomy the only way to treat bowel incontinence? Select yes or no. Correct. A cecostomy is not the only way to treat bowel incontinence. A cecostomy is only used if other methods of controlling bowel movements do not work. The cecostomy tube is placed in the cecum. Select true or false. Correct. The cecostomy tube is inserted through a thin needle into the cecum. Emily has noticed redness, bleeding, and pus around her son's cecostomy tube. Should Emily call her son's healthcare provider? Select yes or no. Correct. Redness, bleeding, and pus around a cecostomy may be signs of a problem. Emily should contact her son's healthcare provider. You or your child will be able to perform the antegrade enema 1 week after surgery. Select true or false. Correct. After surgery, you or your child will be able to perform the antegrade enema. An enema through a cecostomy is usually done at home. Select true or false. Correct. The cecostomy tube is placed in the hospital. The enema through the cecostomy is done at home. Thank you for using Explain.